The number of people dying in the United States from pregnancy-related causes has more than doubled in the last 20 years. This is new information that was just published this week in the Journal of the American Medical Association. Dr. Chandra Adams with Full Circle Women's Care joins us this morning to talk about the maternal death rates here in the United States that honestly just seem to be getting worse every time we have this conversation. So this study looked at maternal mortality rates from 2009 to 2019. And what were some of the things that stood out for you? And thank you for coming. Sorry.
Absolutely. Thank you for having me. So the increases across the board, I think it was interesting that this study broke everything out according to not just race, but geographical location, because we always heard African Americans in the South. And so it just seemed like that was an isolated problem to that specific area. But we saw increases in Native Americans, in the Latina community, as well as in the Caucasian community. Their numbers tripled actually in comparison.
Wow. So, you know, in looking at this, they looked at other high-income countries like Netherlands, Austria, Japan, which have actually seen much lower rates even decline further. So what is happening here in the U.S.? Why are we seeing this trend?
I mean, social determinants of health, you know, no one really believed that environmental stress was a thing until COVID. And everyone's under environmental stress. We're stress eating. We're also doing more things that contribute to those unhealthy lifestyles. You see increased high blood pressure, increased diabetes, which are increased risk for cesarean, which is an increased risk for hemorrhage. And these are the factors that were listed in the article as contributing to mortality.
So most maternal deaths are deemed preventable by some of these state review committees. Every time a mother dies, they look at this case specifically. So some of those biggest risk factors that we want to talk about: cardiovascular disease, that high blood pressure, severe preeclampsia, blood clots, maternal cardiac disease, and hemorrhaging. So why aren't these conditions being prevented if they are preventable?
So part of it is that we're not addressing it until we get into pregnancy. These are things that you want to optimize before you even become pregnant. So preconception health here in America, where people don't have access to care all the time, and then we think that giving people access, giving them insurance during pregnancy is enough. And then you pile on top of the obstetrician, who's already stressed because there's a shortage of us. You pile on top of them, now you need to find this person housing, and they need to have adequate food intake. And then they also need to get their diabetes and their high blood pressure under control in this 6 months.
Wow.
Optimize all of this care during this time that your body is going through these physiologic changes that actually worsen those conditions at baseline.
So what does that partnership kind of look like? Because some of what you're saying is shared responsibility. It's a relationship with the doctor and then also the mom-to-be. But it sounds like that really has to start with your general practitioner, and hopefully you're seeing them, but in some cases you're not. So if you want to get pregnant, what does that look like if you want to have a healthy pregnancy?
So one, I think we just also need to look at what are the things causing the mortality. So mental health was on that list. So optimizing your anxiety and your depression before you go into a pregnancy. Getting a therapist or getting on to pregnancy-safe medications. Hemorrhage is another one. So not going into a pregnancy with iron deficiency or anemia. And then hypertension as well. Any of the conditions that can lead to hypertension: pre-existing kidney disease, lung diseases, those sort of things. If you have a clotting disorder in your family, identify those things and get them under control before pregnancy. Have a plan for when you go into pregnancy.
And let me just talk, because, you know, it is a decision. You're picking your doctor, you're picking your midwife, and there's a difference between a birth plan and then that plan to have a healthy pregnancy.
That is correct. And some of the things that, you know, that we hear complaints about are birth experience. And while birth experience is very important, there's a difference between people ruining your birth experience and people with medical neglect, like actually putting your life in physical danger. So if, you know, the first thing to look for is, does your provider believe that there is a maternal mortality crisis? And if so, what things are they doing to address it? And then on top of that, if they're not giving you the experience that you're looking for, then you want to seek out somebody who's giving you the best of both worlds.
Good information. Thank you, Dr. Adams. You know, also don't want to send a panic in people. These numbers are still low, but any mom who dies during pregnancy or after is one too many. Full Circle Women's Care, thanks for coming in.
Thank you.